Good morning, welcome everybody. I am Dr. Jorge Aldrete. It's a pleasure to be here today to talk about the case of obstructive sleep apnea syndrome with behavioral sleep disorder in rapid eye movement phase. Obstructive sleep apnea syndrome is very common but underdiagnosed. It's characterized by repeat episodes of upper airway occlusions during sleep that cause recurrent desaturations of oxymoglobin and sleep fragmentations, which generates a variety of symptoms, including behavioral modifications. Obstructive sleep apnea syndrome affects 14% of women and 5% of men, and the prevalence of this disease is increasing along with the rate of obesity. Moving on to the case report, we'll be talking about a 57-year-old male patient with a history of benign prostatic hyperplasia that he also presents episodes of vivid dreams with a frequency of every 3 months during the last 2 years, accompanied by nocturnal paresthesia in the legs and as well morning symptoms of asthenia and anemia. During these nocturnal episodes, the patient's wife reports that he has attacked, beat, and tried to strangle her at least 4 times. The patient has been treated by a neurologist for a diagnosis of nocturnal automatism crisis with carbamazepine, which made him drowsy. As well, he went to a pulmonologist who diagnosed obstructive sleep apnea and restless syndrome and prescribed a CPAP treatment which produced hypotension, suspending treatment. Physical examination is normal, with the exception of mild instability for 2 Hell gait and positive Romer signs, with vital signs with normal parameters. Brain MRI shows a parenchymal gliosis and probable all ischemic microangiopathy. Also, EEG through outbreaks of mild asynchronous activity with irritative dysfunction in the left temporal region, and blood chemistry has no alterations. Important, the polysomnography manifests moderate obstructive sleep apnea-hypopnea syndrome and periodic limb movements with mild grade. REM sleep behavior disorder. After 3 years of treating the patient with CPAP and clonazepam, he was diagnosed 6 months ago with Parkinson's disease as a comorbidity. Part of the discussion focused on the presence and severity of obstructive sleep apnea syndrome, which are usually determined by polysomnography. The synchronous sleep conduct disorder is a sleep disorder in which vivid, often unpleasant dreams are physically displayed with sudden and often violent vocal sounds and arm, leg, and movements during the synchronized sleep, sometimes referred to us as dream acting behavior. The onset is gradual and gets worse over time. It can be associated with other neurological diseases such as dementia with Lewy bodies, Parkinson's disease, or multisystem atrophy. To conclude, we can say that a good diagnosis rests in a complete medical history and also in a close communication with family members. Thank you everybody for your attention.